Hello guys, this is Binoy Matthew from Harley Street Physio. It's a short video from one of a patient who came to us with severe lateral hip pain, gluteal tendon, very common in women in the 40s and 50s and 60s, which can have a severe impact on the quality of life. She came limping, and after quite an extended period of rehab, we got her back to playing doubles tennis. And although we see a lot of young active patients like runners, footballers and semi-professional athletes, for me the biggest satisfaction is for someone recreational who is struggling with basic quality of life and getting them back into the journey to the sports they love. So here the patient is outlining the typical journey, which can take anywhere from 4 to 6 months from the rehab and other adjuncts.
So we've gone through the hip journey. So tell me about your symptoms and what made you to seek help with us.
Well, I got to the stage where I had to go up and down stairs like a toddler, one step and then bring your foot up and then another step and bring your foot up. And it was extremely painful. Even just walking up a slight incline was painful. So I thought, well, I need a new hip. I've got to that age. And then I was told by I saw that no, I didn't need a new hip. The MRI scan revealed that it was something to do with tendons. And she said, and I have the man for you. He specializes in hips, and if anybody can put you back together again, it will be him. So off I came, and I was given exercises to do, and the exercises changed, and it wasn't just keep doing these exercises and do them harder, faster, longer. Every time I came and had an appointment, exercises changed, the goalposts were moved, and I was given different things. And then when I was ready to go back to playing tennis, the final sets of exercises were things to make certain that when I went back to playing tennis, I wasn't going to injure myself and be all gung-ho. It was how to warm up properly. And the whole experience has been really very positive. And I always felt that I could ask anything and everything was explained. Everything had a reason to do it. It wasn't just mindless, do this and you'll get better. At every step, I was told this is going to increase this is going to do that. The reason you're doing this is that. And if you're like me, you get the advice, and then you do the exercises, because otherwise, stay at home and save yourself the money.
And you came at a very difficult phase where you're limping, a lot of difficulties. Now we are going back to tennis, so that's been a lot of improvement. So how did you see the journey, did you think you'll ever be able to play back tennis? And
I thought I wouldn't be back tennis. I was hoping that I'd be able to go upstairs confidently without holding on with at least one hand, and that I would be able to go up like a normal grown-up, not like a toddler. So to be told, one, that I'm fit enough to play tennis, and more importantly, to feel confident enough that I'm able to play tennis, it's really remarkable. My husband's hip is now too deteriorated to ski again, and I thought I probably wouldn't play tennis again, but I am. And I'm not a great competitive player. I'm a social tennis player, but it's something I really enjoy doing, and now I can do it again.
And we avoided injection, and we gave you SHOCKWAVE, which we know works really well on the tendon. So how was your experience with the SHOCKWAVE? Did it hurt? Was it painful, or what?
No, it's not. It's not painful. It's a sort of unpleasant feeling. But I think the outcome is so positive, and it hastens the recovery so much that it's just one of those things. It's like going to the dentist or having a baby. At the end, you've got the baby, you've had the filling, you can walk upstairs. So the SHOCKWAVE therapy is not a big deal.
So you didn't find it was maybe wrong.
No.
And so finally, going back to your tennis, are you really looking forward to getting back into your normal sports and the normalcy which you always earned for?
Oh yeah, I am, because it's a nice thing to do on a Wednesday morning for 2 hours. I've really missed playing with my friends. It's not the same taking a thermos of coffee and watching all your friends playing around. And I just feel that I'm back to where I was before I had this problem in the summer.
Last thing, somebody was thinking of hip problems coming and seeing us. What would you say to them?
I would say, if you think you've got a hip problem, Don't just wait and hope it gets better. Go and see a professional who can tell you if you need physio, if you need an operation, or if you need to just, sit and do nothing.
Okay, thank you.
Pleasure.
So based on the feedback, there are a few points which I would go through from experience with this sort of chronic hip and groin patient. One, with the tendon issue, especially with hip tendons like the lateral hip or the proximal hamstring, it takes a while. So normally I would say to patient, it's anywhere from 4 to 6 months, and then average I might see you anywhere from 8 to 12 sessions. So it's not a quick fix. So most of my patients don't really see the effect until the 2nd or 3rd month. So it's really important to be patient. It's part of the journey. And the second thing is flare-ups. So a lot of people think it's going to be a steady progress, so it's going to improve week by week. You're definitely going to have some setbacks. So on average, at least 2 or 3. So I say to my patient, you're going to improve month by month and not week by week. So you might have few bad weeks, you'll feel like you're going back, and that's the nature of with any chronic condition, especially with the hips. So it's important to look at the bigger vision. So see how you are in 5 or 6 months, not in a few weeks. So a lot of patients get disappointed and feel like they're going back at stages. We use quite a bit of SHOCKWAVE, which I think can help in pain, and it's a great adjunct other than steroid injection. So it's not a quick fix. It can be extremely painful. So a lot of patients are put off with SHOCKWAVE. So we got good evidence to support it, especially with chronic tendons. And the key message with SHOCKWAVE is it takes 12 weeks for it to work completely after the last treatment. So a lot of patients are looking for quick results, and that doesn't happen with SHOCKWAVE. So you have to be patient. It stimulates the healing response, stimulates your fibroblast, and also it has a big effect on the pain, but it can be extremely uncomfortable. So it's looking into the bigger picture, and you can get flared up, a bit of skin bruising and things like that. And more and more clinicians are using SHOCKWAVE instead of more invasive options than surgery or injections. And the last one, which is really important, is making your exercise personalized and progressive. Just giving them a bit of exercise and not seeing them in 6 weeks or 8 weeks is not good enough. So we see them at least once in 2-3 weeks to progress their exercises, see whether they're following it, and also to personalize it. So it all comes to the end goal. What do they want to get back into? So that's the aim of that sort of tailoring it. Hopefully this video was useful, and if you're struggling with chronic hip and groin pain and not progressing, contact us, any of the hip team. More than happy to help you. Thank you.